How many people actually know what is oral cancer and what causes it? Stay with us while Dr. Rajagopal explains it to us. Dr. Rajagopal practices in San Jose, California. She feels very passionately about getting the message out about oral cancer. Thank you, Dr. Raj, for coming here.
You're very welcome. Thank you for having me in the studio.
Now, where are the locations in the mouth that we might find cancer?
Cancer can be found anywhere in the mouth, starting the floor of the mouth, the tongue, the inside of the cheeks, the palate, the soft palate, the hard palate, and even the gums. So pretty much, and you're looking at the lips too. So pretty much any spot is potential for oral cancer.
The tongue, and what about the lower back part of the tongue by the
Yes, absolutely.
lingual tonsils and things
Yes.
like that? Is that also?
That's also a potential site. Now, we were talking about oral precancers first. Oral precancers are conditions in the mouth, lesions in the mouth that have a higher malignant potential than its normal counterpart. Oral precancers, the popular ones, are erythroplakia, leukoplakia, and oral submucous fibrosis. Erythroplakia is a reddish, fiery reddish patches in the mouth that have a very high malignant potential. Leukoplakia is a plaque-like white patch in the mouth, anywhere in the mouth, that cannot be attributed to any other condition. For example, it cannot be attributed to a yeast infection or anything like that. And the third one is oral submucous fibrosis. These are fibrous bands that are all over the mouth. So these three have the highest malignant potentials. So these are the ones that we look out for.
So what would be some of the symptoms then for all these different areas of cancer? If you don't, say, go to a dentist or something, how would a person know that they had something that would be cancerous?
So any lumps and bumps in the mouth, of course not all lumps and bumps would be cancers, but lumps and bumps in the mouth, then any burning sensation anywhere, inability to open the mouth very well, that's another big one, and burning sensation anywhere in the mouth, and tingling sensation in the mouth. So these are all the various possible symptoms of oral cancer. The sooner that they are detected, the better. So that's why it's always good to go to the dentist or the doctor, have your follow-up appointments, regular checkup appointments where they can be discovered.
So then would it be fairly easy then to discover these? Do they do biopsies or?
The first one, of course, would be a visual confirmation, and that's just the initial step. Biopsy is the go-to step for a confirmation, for an accurate confirmation about what's going on. The biopsies are very simple procedures. Usually, sometimes they use local anesthetic and sometimes not. A little piece of the tissue is removed and sent to the lab where they send it back with the results, and we know what's going on at that point.
What kind of treatments then would you give for the various types of oral cancer?
So the treatment depends on the location of cancer and also the spread of cancer. Now let's say it's in a very accessible area and it's in a very the spread is it's in very initial stages and things like that. Then a complete surgical removal of that spot is the easiest way to go. But depending on what the oncologist and the radiologist decide, of course, it's going to be radiation or it's going to be chemotherapy, depending on the location and, like I said, the spread of the cancer. But these are things that have to be balanced very well, and of course the side effects of any of these things have to be considered. But cancers have to be that's how they're removed from the body.
So would it require different kinds of surgeons for the different locations in the mouth then?
Yeah, usually a team of surgeons are going to work depending upon where the particular, the oral surgeon is the person usually who will probably be doing all the surgery there and everything. But if it goes into the ear, nose, throat area, if it goes further back, then probably the ENT surgeon will also be involved. But primarily it will be the oral surgeon.
So it could be in the ear channels, I guess it would be like in the sinuses.
Yes,
Where-
it could be,
okay.
most definitely.
So that would still be considered oral cancer then?
Yeah, I mean, if it starts in the mouth and spreads to the sinuses.
So then an oral surgeon does all of that? Because I always think of an oral surgeon as the one who pulls your wisdom teeth
wisdom
out
teeth.
when you get braces or something.
No, specialist oral surgeons do cancer surgery, and that's definitely within the scope of the oral surgeon.
So they go in the ears or the nose or...
Yeah, I think when it goes into the ear and the nose, there might be a team of surgeons working, but definitely the oral surgeon will be involved.
Well, what are some causes of these various oral cancers?
So the primary cause of oral cancer is actually smoking. Tobacco, smokeless tobacco that's kept inside the mouth, various locations inside the mouth. I see that people keep it in this fold of the mouth, especially near the lower molars. They keep it in the fold. A lot of players, especially baseball players, I believe, do that. They keep it on the inside of the mouth like
Chewing
that.
tobacco.
Yeah, chewing tobacco. Tobacco is the biggest risk there for oral cancers. The second one would be, of course, alcoholism, any kind of heavy alcoholics. So it is said that statistics say that the combination of tobacco and alcohol increases the risk by 50-fold for malignant potentials. So that's why it's very important. I tell people, please be aware of this. Please stop smoking. Excessive alcohol use. So an unexplained sore or an ulceration anywhere in the mouth that does not go away within a few weeks should be a big flag to get it checked.
A few weeks even. Huh?
A few weeks, yeah. Because if it's any simple ulcer, it should go away with, let's say, a vitamin deficiency ulcer or a stress ulcer or something like that. Or even when you bite your tongue or when you bite your lip, it should go away quickly if it's not, if it's not turning malignant in some way. But if it does stay for more than a few weeks, then you should definitely get it checked out because there might be something wrong.
Could be some food allergies would cause sores in the mouth.
Yes, yes, food allergies also would cause. But then these things have a cause and effect, and as soon as the cause is removed, for example, you stop eating that food, that allergy should go away. But with oral cancers, they're not going to go away. It's only the thing about oral cancers is in the beginning stages, they might be completely asymptomatic, no symptoms at all. It's just a vague feeling, something, something is wrong, or even nothing. So that's the reason if it progresses a little bit more, there is going to be, tingling, numbness, or pain, or bleeding, or such things. But anything should be checked out when suspicious.
So like you said, a lump wouldn't necessarily be hurting, but you would feel the lump
You would feel
in
the
your
lump.
mouth, so you
Yeah.
would be suspicious that it's
Yes.
something like that. And then just regular, like the cold sores that people get, if they, do those ever develop into cancer?
The chances of cold sores developing into cancer is not very well documented. It's a cold sore comes and goes away. That's nothing to be worried about. But again, if it goes away within a couple of weeks, then we are good. But if it stays on, then it probably was never a cold sore to begin with. So it has to be biopsied.
I read in a magazine article recently that some mouthwashes, if they're not diluted, can contribute to cancer
ones-
long term and so forth, if they're harsh.
Yeah. The ones that contain alcohol have always been questioned whether they are the cause for oral cancers. Again, the link between the two is not very statistically proved, whether this alcohol will actually cause oral cancer unless you're swishing with it like every minute of your life, I guess. But it's not very well proven, and that's still under investigation. So they still have to do a little more studies there, I think.
How effective are the treatments when they start removing these cancerous tissues and so forth? How effective is treatment for oral cancer?
The treatment is very effective if the cancer is in a very early stage. The further we progress, the more and more complicated it becomes. For example, cancer spreads. This is like any other cancer. This spreads through the lymphatic channels in the neck. It spreads through the nodes. It can spread to distant sites like your lungs, etc. The further along the cancer is, the harder it is to control it. And unfortunately, there have been lots of cases where we've lost the battle, right, as the cancer progresses. Very important to have it diagnosed in a very early stage and have it treated in a very early stage. There are excellent chances after that. But the longer we wait, the more the problem is.
So it's a good idea to go to the dentist regularly.
Yes, definitely.
Now, if somebody goes for their annual health exam, because under Medicare you get one every year, should the doctor then be looking too inside the person's mouth and checking for oral cancer?
I'm not very sure what how the MD would do it, but I think MDs also would do the same. But I can tell you, for us, as dentists, the 6 monthly checkup that we do, that's one of the first things that we do. We check for oral cancer. We even the patient is a fairly young person who is a non-smoker or a non-alcoholic. I would always tell them that this is the first thing I'm going to do, and it's just a routine thing, nothing to worry about. If you're not into any of these things, the chances that you develop oral cancer is very little. Also, another cause for oral cancer is actually the HPV, the virus HPV. So that's becoming more and more prevalent in younger people because it spreads by intimate contact. So
I guess we heard Michael Douglas
Correct.
talking about that recently. Okay. So that's something to think about.
Correct.
Yeah.
So
and then you do a test in your office for gum cancer, don't you? Isn't that becoming common now?
Some offices will do some kind of fluorescence test. They'll have a special light kind of a thing that they shine inside the mouth to find out more about that stuff. But a visual examination is basic, and it's good enough for now, and we can detect a lot of things with just a visual examination. Anything that we see as suspicious, like for example this leukoplakia that I told you about, these white lesions in the mouth, many people have it. The malignant potential of leukoplakia is not very high, as high as the other one that I told you, the erythroplakia, the red fiery one. But when we do see this leukoplakia also, we say, I see this white patch here. I don't know what it is. Let's have you see the oral surgeon so that they can do a biopsy and find out what it is and what the potential risk is there.
Do bad gums lead to cancer? Like not taking care of our gums?
Yes, over a long period of time, very bad oral hygiene, together with not just bad oral hygiene, together with any of these other habits, can definitely lead to oral cancer. I've seen people with advanced gum disease with really bad oral hygiene, with maggots even in their mouth. Yes, it's true. So those are conducive to other things like tobacco and stuff leading to oral cancer. Now you're giving it the right environment, you're giving cancer the right environment to grow and thrive. So definitely bad gums are not a good idea at all.
Well, bad gums even affect our health in other ways, don't they?
Yes, yes. Bad gums, they are now linking studies of bad gums with heart disease and with diabetes and things like that. That's still under research, of course, because your gums are the portal of entry of bacteria into your body. So if you have bleeding gums, that means if your blood is coming out from microscopic, it's coming out from your gums, something can go in too, simple. So that's the portal of entry into your body. So that's something to watch out for and something to be very aggressively taken care of.
Would people, say, who have kind of bleeding gums, would they be more apt to catch flu and other contagious diseases just through airborne bacteria?
I don't think that is very, that is a well documented fact that you can catch the flu because of bad gums, but you can definitely lower your immunity, which is a big deal, which is a beginning point of many other diseases and stuff. So yeah, probably indirectly it can do that.
Well, how do we take care of our gums?
So regular brushing twice every day. I love electric toothbrushes. They do a great job in plaque control, regular brushing. And then flossing. There is no adjunct to flossing. Your regular thread floss that you use every day, every single day.
There are good ways to floss.
There are good ways to floss, and there are bad ways to floss.
So tell us, what are the good ways real quick?
When you're flossing, you have to remember that teeth are not flat, teeth are not straight, teeth are curved like this. So when you floss, you should feel the curvature of the tooth on both sides. So you have to turn your floss to the front and to the back and follow the curvature of the tooth. That's when you are actually getting the surfaces of the tooth. Now keep in mind, plaque is very sticky. It's very sticky. So you have to kind of rub it out and get it out very well. And if you just go in and out like that, you're probably just hitting your gum and coming back out. So that doesn't work very well. You have to follow the curvature of the tooth.
So it's more than going down and bringing food out. It's actually scraping off plaque.
Correct. Exactly. Exactly.
Now, once a person gets gum disease, what do you do about it?
So gum disease, especially the older we get, gum disease is not something that will go away. Gum disease has no cure in the sense of the word. Gum disease is something that it can only be maintained, can only be managed. It's like high blood pressure or like diabetes. So if you take your pill for high blood pressure one day and say, that's it, I'm cured, that doesn't work like that, right? You probably are on pills for the rest of your life. Gum disease is similar. You have to manage it. You have to do all this home care, do your cleanings every few months to maintain it after your initial deep cleaning. And in advanced cases, you will be suggested surgery, seeing the periodontist, where they can fix the gums. The gum disease goes down to the bone, the jaw bones that's holding our teeth together. So you'll be suggested some kind of surgery also. So
to remove portions of the gum?
No.
Oh.
It is to access the inside, the root surfaces of the teeth. So from the outside, there's only so much of access that you can do. It's the root surfaces that are deep down that if they need to be accessed, then surgery is the only way to access those surfaces. Okay. So very important to follow all these procedures.
So it's almost the gums are more important than the teeth, it seems.
The gums are the foundation.
You can get a tooth filled, but the gums are something else. Well, I know in say 50 years ago, people used to have perfect teeth, but they would have to get false teeth because their gums were bad. And they would lose the teeth, even though they didn't have cavities in them.
Yes,
the teeth would come out. And
yes. Interestingly enough, tooth decay is a problem of the first world, if you can say that, because tooth decay is very related to very processed sugary foods that you eat, right? So what you said is exactly, you hit it on the head. 50 years ago, the additional sugars and all the processed food that we eat now was not there. It was more, I think, whole grains and things like that, right? So the chances of tooth decay was lesser. Now with all this processed food we eat and sodas, and fruit juice that people are constantly drinking throughout the day, or chewy bars and sticky food, so these are the things that cause tooth decay. So
What about sparkling, drinks, even if you would use a artificial sweetener? But do the sparkles, the seltzer, is that damaging to the gums?
not per se to the gums, but maybe to the enamel. The sparkling would probably be abrading the enamel microscopically every time you use it. So a straw would be really good, so that you're not really touching your teeth. That's one of the ways that you can get.
I know we're talking more about teeth than we are about oral cancer, so maybe you want to tell me a few more things about oral cancer.
Most definitely. So I feel very passionate about letting people know that tobacco is one of the biggest causes of oral. Recently, we had a patient who, a young lady, she was a smoker, and we had to remove half of her tongue because of oral cancer. And I tell people, this is no way to live. Smoking is mostly related to, when you hear the word smoking, if somebody had to lecture you about it, you would say lung cancer, right? Oral cancer is probably not very well known among smokers or among people who are trying to quit even. Oral cancer is very, very relevant and very, very hard to deal with, right? It's a debilitating.
Devastating.
Yes, it is. It is. Your lifestyle after you've had oral cancer, where some parts of your mouth, of your face are removed, cannot be anything, fun.
So it's disfiguring.
It's extremely
And
disfiguring.
you can't
Yes.
eat, you can't talk. There's a lot of things that.
Yeah, there are various prostheses that they're coming up with more and more prostheses that can, replace the parts of the mouth that are removed. But which prosthesis would actually, supplement? Which prosthesis would actually change your lifestyle like that, right? Give you back what you had in the first place. Nothing would do that. So that's why it's very important. I tell people, please be aware of this. Please stop smoking, excessive alcohol use.
What do you think you might do that would, in the future, that would bring awareness to the oral cancer?
So like I was saying, I believe baseball players are really into chewing tobacco. So I think that would be my first target, about going to places and educating people about, educating young kids who play baseball about the perils of chewing tobacco. That would be my first thing. This is a few years from now when my kids go to college.
So lectures, going to groups and schools and
Correct.
things, and talking to people.
Correct. So just to bring more awareness in the community about oral cancer and how to prevent it. It's easy enough to prevent it. The carcinogens in tobacco that cause oral cancer, they stop the cell from functioning, the cells inside our mouth from functioning normally. That means a normal cell would die eventually, right? But the problem with these carcinogens is they stop the death of the normal cell. They would alter the DNA, or they would alter the chromosomes in such a way that these cells don't know that they have to die, and they keep forming, and that's when you have these lumps and bumps, and that's basically your cancer. So bringing awareness, showing pictures of all these things, showing pictures of the precancerous lesions that can lead to cancer, and telling people that if you have precancer, this is a warning that's given to you before cancer strikes.
So it's educating in order to get people to change their lifestyle, or
Correct.
to prevent them from taking up these habits to begin with.
Correct, correct. Cancers of cancers, not all cancers are related to tobacco. Like I told you, HPV is another cause for cancers. There are cancers that are in the salivary glands, in the parotid glands behind the ear, and under the tongue, the salivary glands too.
Oh my
So,
gosh. And those would all be caused by the similar causes than the alcohol and smoking, or?
these cancers, we are not very sure what causes them because they are not very directly linked to tobacco as much as the cancer of the, let's say, the tongue or the floor of the mouth or the palate and things like that. But yeah, there have been studies that link it, and it could be benign tumors too of the salivary glands, or it could be cancers.
What about exceedingly hot foods? People whose diets eat a lot of pepper every day. You know, I'm thinking Indian food
Indian
or
food,
Mexican
yes.
food.
Yes.
A lot of
Yes.
Indonesian foods have a lot of
Yes.
heat in them. With
Yes.
I know that has a little bit more to do with pancreatic cancer, I think. But
Yeah.
would that maybe affect the salivary glands and so forth?
Excessive chili use, excessive spicy food use, and I bet all my friends are going to laugh when they hear this because I eat very spicy food. Excessive spicy food is related to cancers, probably because they erode the tissues, they ulcerate, they begin with ulceration of the tissues in the first place, and then weakening the cells that they come in contact with directly, and then possible progression to cancer. But yes, chili has been linked. It's never been the primary cause for oral cancer, but one of the links.
Could aggravate it.
Yes,
Sure.
could aggravate
Well,
it.
they're good for us in a little bit. It's just overdoing anything that we shouldn't do, I guess.
Correct.
Well, thank you for coming and explaining some things about oral cancer because we're
Yes,
all happy to
it's-
know about it.
Yes, yes. It's a topic that's not very well known, so I'm glad I could do my part in bringing awareness to the community about this.
Thank you for joining us. We hope you come again next time. And goodbye for now.